trailblazer, Fikry Isaac. He is with Johnson & Johnson, a coup winner, as you just saw, and he literally leads the gold standard of creating health and wellness solutions for employers, health plans, and organizations at the pinnacle of wellness strategies. He has policies, guidelines, services worldwide that are the envy of the world. Please welcome Dr. Fikry Isaac.
Well, a pleasure to be here, and following Ken is really very unfair, I have to say. The other thing I want to say or disclaim is that I do not have any cartoons in my presentation, so be aware of that. Really, what an honor to be here and to be invited to share some of this with all of you. And really, the Worksite Health and Wellness Program is, it is time to put it on the agenda. And it's just really amazing to see the diverse groups here that really is talking about wellness and how does it add into the well-being and the well world, which is really the theme of this summit, and rightfully so. I'm going to just start by a couple of general statements, then I'll move into workplace wellness, past, present, and future, by saying, and I think you heard it already in the morning, that chronic disease risk factors are the leading cause of death and disease burden in all countries, regardless of their economic development status. So keep that in mind as you look around the globe, from all of you who are coming from 41 countries plus. The other point I want to make is it is really lifestyle factors are going to be seriously impacting economic growth. Non-communicable condition will cause over 3/4 of all death by 2030. So it is time to take action and time to work on it. When we talk about workplace wellness, we have to keep two things in perspective. One, you're really not just targeting the individuals, you're targeting also the organization. So organizations have their own desires and needs and wants, and employees and their families have their own needs and wants, and we need to make sure that the two are addressed as you put in health and wellness program in the workplaces. And I can spend hours talking about each of those, since we have done quite a bit of work on assessing what do employees want and their family want from a health and wellness program, and what does the business needs are, and how can we address that. But we don't have time for that right now. Please feel free through the conference and the summit to talk to me about it, and I'll be happy to share some of that with you. As everybody talked about numbers, I know Susie asked me to talk about numbers, so I'm just going to share a couple of numbers, not a lot. But looking at organizations that effectively engage employees, and the word is engaging their employees in their health, have a distinctive competitive advantage. Some of this is shared in some of the Towers Watson survey that is done for Fortune 500 companies worldwide. And the health risk factors, those companies that value health as a competitive advantage and serve their population in such a way, have 26% fewer cases of high blood pressure, 22% lower of their BMI or body mass index. They also have 47% fewer diabetic high glucose risk factors, and 18% fewer users of tobacco. So a lot of that is available out there in the industry, and you can certainly take a look, and I'll be happy to share some of those data sources with you. But let me now switch to the Johnson & Johnson story, and I will try to share that with you in the next 10 or less minutes, knowing that it's a story of over 30 years in the works. Johnson & Johnson have their health and wellness program for over 30 years. And actually, if you look at this slide, these pictures are taken from the Johnson & Johnson Museum, the archives from the 1800s. Back then, the general actually had an on-site fitness center and a sport teams, women and men sport team in his factory to help employees to get engaged and address their health need. He also had a little clinic. You could see a bed, you could see a little rocking chair, and some medicinal cabinet there. That was back in the 1900s. So the history goes back there and continue through today and to the future, which I'll be talking more about. And I will do this in a storytelling. There is power in telling stories. So if I look at where we started, at least on my clock and in my time, which is not 1979, by the way. I've been there 26 years only. But 78, the CEO back then, he had the vision of having the healthiest workforce in the world. And he thought by offering them tools and resources on site, that actually he will get them engaged in taking self-responsibility. But he also thought by doing this, he is going to reduce the cost of healthcare to his population. So he did express what his vision is and what his desires are. I'm not going to take you through the whole, the past to the future or to the current state, but the key points to make out of this is a couple of things. One, in 1995, I think it was mentioned earlier, when you look at health and wellness program in workplaces, you will find, clinics run by the HR folks. You'll find EAP program or mental well-being program run by someone else, and you'll find wellness program, who knows who's running them. In 1995, J&J is a very decentralized organization, 250 operating companies worldwide, run by each company, run by their own different leadership teams and their own presidents. So they have different culture, different population, operate in 65 countries. And I do have the honor and the privilege of worrying and taking care of 130,000 employees' health across the globe and their families wherever they are. So it does keep me busy a little bit. With that in mind, in 1995, we saw there is a gap. There is silos. So we decided to combine all these departments and all these services and centralize it so we can have consistency on the program that we deploy across the US. That was back in 1995. Another milestone change is in 2004, where we actually decided to go globally. US, 35,000 employees. Around the world is the rest of that 130 plus. So really unfair not to address all the needs across the globe. And that's what we have done. Today, we have a One Health organization deliver consistent program across the globe. We have what's called 12 Culture of Health program. They go from wellness program and prevention program to energy management, which I'll talk about for a few minutes, to occupational health services, and so on. The other unique piece in this story is in 2010, we took a decision that health should be front and center. We included in our sustainability reporting, which is publicly viewed. You will see annual reports about how are we performing on health across the globe for our own population. So it is really, health is mission critical to where we are and where we're going. I'll take you here. This is just a holistic approach to our central delivery system. The center is Johnson & Johnson employee and their family. That is the key focus. That is the caring for J&J. I'm not going to take you through all the program, what we offer currently, but really it combined healthy lifestyle program, on-site presence with staff that address nutrition, that address lifestyle health risks, that addresses mental well-being, certainly anything that has to do with workplace injury, illnesses. So we really covered the 3 Ps, protection, prevention, and performance. Now, the add to this is actually what you see there, energy management. We are not in the energy business, as you know, we're healthcare. But we actually introduced energy management when we acquired a company called the Human Performance Institute in Orlando, Florida. The principles of that was really intriguing to me as I went through the program back in the days when we acquired the company, because really it took a different view of health by looking at energy and how can you expand energy to perform better in your personal life, but also at work. And it really takes you through a training that covers the physical, the mental, the emotional, as well as the spiritual aspect of life and person. So the focus has been, and that's where we're moving to the future state, is to focus on mission and purpose for individual and how that links to their health and their well-being as a way for the future versus focusing on just purely addressing health risk and some of the extrinsic motivation versus intrinsic motivation. And I've seen through the years where we started this program since 2010 till today, we actually have trained about 60,000 people within Johnson & Johnson on the principles of energy management. And our goal for 2020 is to reach the rest of our population worldwide. So moving to the future, 2020 vision. So it is still circling about having the healthiest workforce in the world, has not changed. And to do so, what we're really looking at here is not looking at individuals to improve just their blood pressure or their cholesterol. How can they perform at their and feel as their personal best? That is really the key. It is not about their weight. It is how do you feel inside. I think I heard that earlier today from many of the great speakers here. So how can they invest in their best, their personal best for the future? And that would be really the key driver for our program. But the second piece is, how do we create the environment that allow them to make the choice that they want to make on health, from food choices in our cafeterias to walking trails to a building that is a healthy building versus a building that lead to illnesses, and so on. But also the critical thing as we move to the future here is the whole notion of life and work balance or imbalance, and how can we try to work with them to keep them engaged, to allow them to look at that purpose and how that can lead them into serving themselves and their families and the communities better. These are our 2020 objectives and goals. Focus again on personal best. The energy management is our key deliverable for the future, and we are committed to doing that. The second exciting thing that I want to share with you is our learning over the last 5 years when we set our 2015 goals, and just so you know, we already achieved them and actually exceed those goals as we speak, is now to try to make health on the go. A lot of people working now remotely, a lot of people are around the world. Access as well as scalability is an issue. So we're moving our program into a new platform. It's called Healthy and Me. And it's a mobile platform that allows our population to have everything they need on health on their phone, on their iPad, wherever they are, mainly to also be selective of what they want to put in to address. Do they care about their nutrition? They can download a J&J related nutrition app, or they can select their own from whatever country they are at. Challenges, which is really exciting way to get people engaged in physical activity, nutrition, and other things are part of this platform. Certainly, allowing some of this excitement and fun when we look at health and wellness in the workplace is really having point system that they can redeem, get few things here and there that help them kind of to energize them on an ongoing basis, but also creating a social network and a social media that allow people to connect with each other on matters that make a difference to them, and how can they learn from each other and not just from the employer, which is Johnson & Johnson. So with that, I want to close by saying, I told you I'll be talking about stories. So really, from old to new story, that's what we teach in our Energy for Performance and Life program, is to write a new story. So the old story is really the wellness and the well-being program are nice to have. Looking at the future, really, and the new story, they are must-have, they are essential. As I heard earlier, they should be mandatory. moving from an environment that may not be connecting to health and well-being to environment that enable healthy choices in the workplace or outside. Leadership is critical to success, from the CEO all down to the manager that is managing a line operator must really get the leaders engaged, because that makes a huge difference for sustainability for the long time. The work-life balance is a critical challenge. It's going to continue to be a major issue for the future. We still don't have the full solution for it, but we're working on it and hope we can solve it. With that, I want to close by saying what you're doing here is just fantastic. To build this well world, we really must think big. We can start small, but we need to act fast, because the time is now, and really, it is a pleasure to be part of this effort. Thank you.